The Teabba Network. As always, it's a pleasure. We welcome Dr. Solomon Joseph, who is from Territory Hearing here in Darwin. Welcome.
Thank you very much, Lee. It's a pleasure to be with you.
Now, it's always a pleasure to get you in on a Monday to talk all things ears. And one important topic we're going to cover today is ear infection management. Can you tell us a little bit about that?
Absolutely, Lee. And infection management. Okay, ear infection. Many times, people will get the ear infection, especially children will get the ear infection, and that need to be treated. And the audiologist can diagnose that ear infection using a machine called tympanometer. This is a machine we uses. Because there are different versions. Okay, this is a portable version, and the more important thing is in almost all our indigenous communities in Northern Territory, there is a tympanometer. And when I used to go to community, I used to train doctors and nurses how to use this machine. And I think the listeners need to know that, okay, many community having, this machine. So whenever you have, your children having any ear infection, you can, ask. The doctors can use it. Sometimes there is no doctor, only nurse can, only nurses in the community. And they can also use the tympanometer to find out, but they need to have a training from an audiologist before they use this machine. So because there are some do's and don'ts, okay. And the other important thing is infection. Basically, even otoscopy, when we do looking at, the first and foremost, we take the case history from the person when they come for an audiology appointment. And when we take the case history, we come to know that which side is the bad side and which side is the good side. And generally, all the health professionals, they need to start from the good side. Otoscopy should be start from the good side. Why? The reason is, this is otoscope, and this is a speculum we use at the tip of the otoscope. So this is the one we put. And if we put it in the bad ear, where the ear can have a otitis externa infection at the outer ear canal, and after putting on the bad side, and if we put the same speculum on the good side, we are transferring the microorganisms, infectious stuff, from the bad ear to the good ear.
Oh, so that means that it can actually infect the other ear.
Correct. That is the point. So we need to start from the good side, and if the other side is infected, no problem, because we looked at the good side first, and then we are moving to the bad side, not the other way.
That definitely makes sense.
Okay.
Yes.
So this is applicable to nurses, doctors, or anyone, looking at that. And the same thing, sometimes people use cotton bud to put it in the ear. Cotton bud usage is not good because it will push the wax further into the ear. And if you are desperate to put something in the ear, and if you want to do it, use at the good side first, and then the other side. Don't the other way. Don't put it the bad side. And if you put the same side on the tip on the other side, you will be transferring the microorganisms from the bad side to the good side.
So then you'd have two infected ears, and we don't want that. We know what it's like when you get an ear infection. It's not a pleasant feeling, popping or ringing in your ears and stuff like that. So if they do have an infected ear, what should they do?
They need to go to the clinic. Basically, the doctor will have, if they have a doctor, the doctor will look at the ear. And part of the diagnosis is looking at the ear through the otoscope. This is a model of the ear. So if you look, basically what we are trying to do is looking through the otoscope how the ear canal look like, and we will have a cone of light. If the tympanic membrane is a very thin skin, and if there is no fluid behind the eardrum, there will be a cone of light, and we will know that there is no fluid behind the ear. Suppose there is fluid behind the eardrum, it will be looking very dull, and sometimes if there is too much fluid collection, the tympanic membrane will bulge and look like a donut. So they need antibiotic straight away. And in our community, the nurses also can prescribe, because that is a unique situation in Northern Territory because of lack of doctors in the community and in the territory altogether. So the nurses, according to the CAPA guidelines, they can start medication too. So, and when we use the otoscope, there are different types of otoscope. This otoscope has got focal point. You can adjust the focal point here. Okay, the length of the ear canal will vary from children, vary from different individual. Okay, bigger ear canal and shorter ear canal depending upon the head circumference. And the children's ear canal can be a bit more shorter. So the person with the glasses, the vision can vary. So that is why the focal point is very, very important. You can adjust the focal point on this type of bit more expensive otoscope. But this is a cheaper version, maybe $50 or so. This is $900. This has got no focal point. You just switch on the light, that's all. Okay, so there are so many things we need to consider in audiology as looking at the ear. And the other important thing is this machine. This machine is so powerful, the tympanometer is a mid-layer analyzer. It will cost around $4,000 to $5,000. And here also the same thing applicable, because we always start with a good side, because there are different types of tips you can see here. Okay, we always start the mid-layer function test on the good side, not the other way, because otherwise we have to change the tip. We have to use another tip. Okay, tympanometry tip for the other side. Okay, always start with the good side. That is why ask the people the case history. Which side is the problem? Which side is not the problem? Okay, get the information. And this machine will tell a couple of very important things. This will measure. What it does is basically that machine does is it produces a positive pressure and a negative pressure. Tympanic membrane being a very thin membrane, it forces the tympanic membrane to vibrate positive and negative. So if it is moving nicely, we'll get a nice peak. That means normal mid-layer function. Suppose a person is coming with ear infection. What happens is there will be fluid accumulation in the middle part of the ear. And when the positive pressure kicks in, the fluid will be pushing the tympanic membrane from inside to out. So the eardrum will not vibrate. And then you will get a flat line. That is indicative of mid-layer dysfunction. And if someone is coming with a perforation, a hole in the eardrum that is dry, what will happen is this machine will measure the ear canal volume. From here to here, it will measure the ECV, that is called the volume, ear canal volume. If there is a hole, what will be the ear canal volume? What do you think, Lee?
I think it'll be probably here.
It will be a bigger number.
Yeah.
Because of the hole, it will measure the outer ear and the middle ear. Okay, and that will be a bigger number. That itself clearly shows that the person has got perforation in the ear. And sometimes the eustachian tube, the tube that is connecting from the middle ear to the back of the throat, will not be opening up. That is called eustachian tube dysfunction. It will be, the tympanic membrane can be so much retracted and it can be blocked. So that is why people need to do Valsalva. Close the nose and blow the nose. Okay?
Yeah, to try pop it.
Absolutely. Yeah. And our indigenous new mothers, whenever they take off on a plane with a newborn baby, always remember they have to breastfeed, because for small children, they cannot do this Valsalva maneuver. We cannot give lollipop to a newborn baby. So they have to breastfeed. Each time when they breastfeed, what will happen is each time when the baby swallow the milk, the eustachian tube will open up and it will ventilate, and baby will not cry during takeoff and landing. Very, very important thing. Okay, small things, but it's a powerful tool. Okay, powerful tool to help the children and our community people, and generally any individual who is listening to this interview. Okay, there are so many infection control things we can do in audiology, the ear health.
Thank you so much for that. Now, before we wrap it up, can you leave us with 3 tips to manage healthy ears, and especially if they've already started treatment? what should they do?
Absolutely, very good question. Basically, when there is infection, better don't jump into the dirty waters. It will create more problems in the ear, and don't. Okay, and you can do Valsalva maneuver sometime. Okay, if there is blockage, okay, that will help to aerate. Okay, we're forcing the tympanic the institution to open up, and always clean with a clean cloth. If there is wax is coming out, always use clean cloth. Okay, we don't want infectious stuff going into the ear. And these are the simple thing. Okay, everyone can follow in the day-to-day life.
Thank you so much for those helpful tips, and also how to manage ear infection and how to use the tools when coming in to get your ears checked at the clinic. But it's not overwhelming. They do look like I think a